ready to start? Okay, good morning. Thank you very much for the invitation. We have here a pregnant lady, 24 weeks of gestation. I just need to admit that I'm not very familiar with this setting, but actually, most of the ultrasound machines are having the same systems. Therefore, I'm going to try to do my best with this lady. We asked for a twin pregnancy because actually in twin pregnancy there are so many other things to check, and it's very important to be careful in the evaluation of these twins. Okay, I normally have an overall view of the uterus. I just started the fundus. I'm moving down. You can see that one baby is here. You can see part of the intertwin separating membrane over there. You can see the amniotic fluid, and then you move down to the other baby over here on the right side of the screen. I'm now over the pubic, in the lower part of the uterus, and you can see the two heads in this area. Now I'm going to have a sweep coming from the maternal right to the left to have, as I mentioned, an overall view. You can see here that one baby is up there and the other baby is over here. Okay. Once you know the position of the babies, you can see here one head and the other head, you must be sure that the two babies are alive. And the best way to do this is just to feed your transducer in one of the head and just start moving through the back of the baby, trying to see the heartbeat. Okay, you see here the heartbeat, that means that this baby is alive. You move back to the head, and then when you have that head, you go to the other one. And then you do exactly the same, moving up and checking that the heartbeat is over there. You can see that the two babies are alive. Both are in the vertex cephalic presentation, and actually you know that one is on the right and the other one is on the left. Okay, once you have this, a good overall view should include the amount of amniotic fluid. You can see in one of the baby over here, you have a good deepest pool. Then you move here. The best way to have a look to the both cavities is trying to find out the separated membrane. When you see the separated membrane, you can have a good look of the amniotic fluid in each side of the membranes. And you can see here there are enough amniotic fluid from the babies. You can see that the intertwin membrane is very loose. You can see here. That's why, the babies, every time that they hit the membrane doesn't rupture because it's very soft, and you can see here it's waving on this area over here. A very important thing in every multiple pregnancy is not only to know how many fetuses are in the womb, but also to check for the chorionicity. That could be a little bit tricky when you're dealing with a second trimester fetus. Normally it's easier in early pregnancy because the separating membrane can give you the information straight away. But here, for example, when you have this, there are several ways to find out the second trimester chorionicity. One way to find out the chorionicity is trying to find out the sex of the baby. Why is this? Because if you have discordant sex babies, it's a dichorionic twin pregnancy, and if not, you need to find out a little bit more in your information, okay? It's very important that every time that you're checking a baby, you just keep in that area. Here, I'm in the baby located in here. Sometimes you need to tap just to be sure that which baby are you checking. I'm tapping here the maternal abdomen to see that this baby is on the maternal right. You can see here the head. You just move up, you go to the thorax over here, the abdomen, and then you get to the lower part of the babies just to find out the fetal gender. Do you know the gender of the babies? Okay. And then you can see here, and it's very, I'm going to amplify this.
Oh, you want to zoom? Zoom?
Yep.
So you just...
Then you can see here that this baby is a baby girl over here. You can see very easily over here in between the legs, okay? That means that we have one of the babies already, is a girl. Then you move back, it's always, you need to start from the same starting point every time. And the best way to find out is where is the head. I came back to this, and then I moved to the other twin. This twin is located on the maternal left, and you can see here that the spine is there. I'm going through the thorax, going back to the lower part of the abdomen over here, and also you can see here that this is a baby girl as well. Here we have two options. Either they are dichorionic or they are monochorionic. There is no way to be dichorionic by ultrasound because they have the same sex, both babies. Then you need to find out the second way to find out this is trying to see where is the placenta located. Why is this? Because all monochorionic twin pregnancies have a fused placenta. Actually, it's not fused because it's just a single placenta. But dichorionic twins may have a fused placenta that actually looks exactly the same as a monochorionic twin. And then we need to find out the position of the placenta. And to do so, I'm just doing exactly the same that I did at the beginning. I'm going from the lower part of the uterus to the upper part, just trying to find out the position of the placentas. And then you can see here that one of the placenta is in the posterior wall. I'm moving up, trying to find out if there is another separate placenta. I'm just moving to the top, and you can see that it seems that there is a single placental mass. In this case, could be exactly the same. Could be monochorionic or could be a dichorionic twin pregnancy with a fused placenta. And then, after that, I just need to find out, about the membrane. The separating membrane is the one that actually is going to provide the additional information that you need. There are two ways to find out the chorionicity just looking at the placenta separating membrane. One is seeing the insertion of the separating membrane in the chorionic plate. Here could be a little bit tricky because the placenta is in the back. You can see here that it's not easy to see the junction of the membrane with the placenta, looking for what is called the twin peak sign or the lambda sign, because in this case you can see that it's not easy to find out where is the exact insertion of the membrane on the placental mass over here. I'm trying to find out here, but you can see that it's not very easy to find out. If I don't have that information, the other way to find out is the thickness of the intertwin membrane. And the thickness of the intertwin membrane is quite a subjective criteria because most of the time you should be able to measure the membrane, but there is not a clear cutoff saying which one is going to be a dichorionic and which one is going to be a monochorionic twin pregnancy. I use a trick that actually, for me, has been working quite well. If I do a magnifying area of the membrane, what I'm going to do is just to put here the membrane, and I try to put the membrane in the same direction than the ultrasound beam, trying to find out if I can see it clearly or not. Normally, when you have a very thin membrane, the membrane disappeared in some of the portion of the membrane. Here, for example, you can see that this membrane is coming this way. It's very hard to see over here. Here is a folding of the membrane. Then I can see a little bit better. But all of a sudden, you see that actually, the membrane is very hard to see over here. The only way to see this membrane quite well is just to put in a transverse view. Be careful because here you can see that there is the umbilical cord, but when you see the membrane in the transverse view, you can see that it's very easy to see this area over here. But if I put there in the longitudinal view, you can see that the membrane is more difficult to see over here. That means that we have same like fetuses, one single placental mass, and a very thin membrane. That means that probably this is a monochorionic twin pregnancy. Do you agree with that? Yes? Okay, when you have that, you know, if you're dealing with a monochorionic twin pregnancy, there are several conditions that actually you should be aware of, because one of the main complications in these pregnancies is a condition that's called twin-to-twin transfusion syndrome. And also there is another one that is called selective IUOG. That means that one of the baby is growing much more than the other one. And the reason for this is that here in the placental plate, normally you have a lot of connections that's called anastomosis in between the twin circulations. And if you see over here, this is the placental plate, and normally you have a number of communications between this circulation and the other circulation over here that can produce some sort of imbalance between the twins. What are the features of twin-to-twin transfusion syndrome? Normally one baby gets smaller with less amniotic fluid, a very collapsed bladder, and on the other hand, the other one gets a lot of fluid, a big bladder, and also is much bigger than the other twin. The best way to find out this condition is trying to measure, a simple way to find out is to measure the amniotic fluid, the deepest pocket. Because normally, for definition, when you have a twin-to-twin transfusion, one baby should have a deepest pool over 8 centimeters. That's the, you can see here that this is 6.6 centimeters, that is within normal range. And then you move to the other amniotic sac, and then you try to find a deep pool without umbilical cord, and you can see this is 4.8. That means that here the amniotic fluid is absolutely normal in both gestational sacs. This is very important as a first line of diagnosing twin-to-twin transfusion, and the second one is to see if one of the baby have a large bladder or a small bladder. You can see here that in this area, you can see a small bladder over there. I normally use color Doppler just to be sure that that's the bladder, because there are 2 vessels surrounding the bladder, alongside the bladder, you can see here, and that's, I'm quite positive that this is the bladder in one twin, and there is some urine in there. If I go to the other one, I do exactly the same. This baby got smaller, a larger bladder over here. But also you can see the arteries. Can we put the color down? Yep. Yes, we're going to do here just to find out the vessels, to decrease the over there. You can see here the bladder in one twin and the other. Is with split the image here.
Split, you want to choose?
Yep. You can see that one of the baby got that, and if we go to the other one, how can I?
So then you want to go right?
Okay, we have one bladder over there, and you can see the bladder in the other twin. That means that with the normal amniotic fluid and with the normal bladder, you can almost rule out that these babies are not presenting any twin-to-twin transfusion syndrome, at least the severe forms of twin-to-twin transfusion syndrome. Okay, when we have that, the other thing is that just to need to move to the to the placenta and the umbilical cord. Why is that? Because the placenta and the cord can present several problems, especially in twin pregnancy. One is try to find out the location of the placenta. Here you can see that the placenta reaches the fundus over here, the upper part of the uterus. If I move down, I'm trying to find out if this is a low-lying placenta or placenta previa, and you can see that this is the lower part of the placenta. I keep moving down, and you can see that the lower part of the uterus is free of placenta. I'm trying to get a longitudinal view of the cervix over here, and you can see that the placenta is well located, and it's not a case of placenta previa. This is important because the placenta occupies a lot of space in any twin pregnancy, and that should be a very important thing to find out if the placenta is low-lying or not in these cases. Also, the twins normally have several problems with the umbilical cord, and I'm going to try to find out the location of the umbilical cord. And here is very important just to scan the surface of the placenta. I'm going to start with the twin on the left. I'm going to use the color Doppler because that's the best way to see the circulation. Trying to move this a little bit. This is quite tricky because the babies are staying over the placenta, and you can see here that the insertion of the umbilical cord is over here. It's a little bit marginal. You can see here that most of the placenta is around here, but this umbilical cord is very close to the edge of the placenta. Normally, you have a marginal insertion when the umbilical cord is close to 1 or 2 centimeters from the edge. This could be one of the cases. And then we move to the other twin, trying to find out where is the other umbilical cord insertion. And we do exactly the same. We go to this area over here, and you can see that this also is a little bit eccentric insertion of the umbilical cord. Normally, half of the twin pregnancy may have problems with the insertion of the umbilical cord. Okay, when we have that, the other thing that we need to find out is the size of the babies. And for this, we do the standard biometry, checking for the size of the head, abdomen, and femur. Here is very important to measure one baby first and be sure that actually you are measuring one baby and not the other. Here you use some magnification just to see part of the anatomy. This is very important to do in the second trimester, try to check not only the size but also the anatomy of the fetal head. Here, for example, when you get the views of the head. Here you have a clear view of the midline. If you move a little bit back, you will see the posterior fossa. This is the cerebellum over here, cisterna magna. Normally the cisterna magna has some areas over here, echogenic lines. This is absolutely normal. You can see the vermis and the two hemispheres. Here you have the midline, the thalami, and you should check for the ventricles, the atria. You see the posterior area of the atrium over here, and also in the anterior part of the baby's head, you should see the cavum septum pellucidum here in the front. You see here the cavum septum pellucidum over here. This is roughly a normal intracranial anatomy in this fetus. The fetus at the moment is looking at the right side of the screen, and when you have the transthalamic view, you just measure the baby's the BPD over here, and you enter this, and then you go to the here you have the HC. you go here to the HC, and I need some help with this.
So the first one.
Well, you go from the back to the front, and then you check for the HC, and you enter this here. Okay, we have that. And also you do exactly the same for the abdominal circumference over here. This is a nice view because you have, the abdomen over there. You have part of the umbilical vein. And then just to do the measurement, you go to the abdominal circumference here. And then you put your measurements in the system. And also you move down to the femur length. You can use the trackball and the cine loop facility just to use the best way to find out for the femur length. Okay, when you have this, you can calculate the estimated fetal weight. And here you have the information about the gestational age calculated by the head, abdomen, and femur. Then you go to the second twin, you do exactly the same, and at the end you just compare these measurements to see if there is a discordancy in weight or not. This is the second twin, also the baby is in cephalic presentation over here. You can see the midline.
It's going to average those because I didn't start with that.
Okay.
Do you want me to just start another patient?
Yep.
Just quickly?
Then we're going to move into a second page over here, because if you put all of the measurements in the same, you're going to have overlapping of the data. Here, we amplify here the zoom. You just use this, and then you have here exactly the same measurements. You see the posterior fossa, you see the midline, the thalami, you see the cavum septum pellucidity, and then when you have a good view and transthalamic view, you just go to the measurements over here, out to in, and then you go to the HC.
Give you that one when you want to enter it. The one more.
Over here, and then the HC over here, and then you enter the information. You just go exactly the same to the abdominal circumference. Here you can see the stomach. This is the stomach, this is the umbilical vein. This is a nice view of the fetal abdominal circumference. You go to this. As you can see, it's very quick and easy to do. And then you go to the femur length over here. And we get this at the end. And then you get exactly, the 24 weeks measurement for this baby, and you compare them and to see if there is a discrepancy or not, over 20% or not. Okay, the other thing is just to check for the anatomy. Normally, every twin pregnancy should be scanned in a tertiary referral center because there are too many things to do. It could be a little bit complicated to scan all of these babies. Sometimes, the anatomy is very difficult to ascertain because sometimes the babies can be covering some very prominent areas and can be very difficult to do a full anatomy scan. But in this case, the babies are behaving quite well. Let me try to get some information about the face. This is the baby on the left. You can see here, you can see part of the profile. Here is the one eye over here. Sometimes, here you can see the frontal bone and also the nasal bone. It's very important to see the upper lip. Sometimes you can see the coronal view very easily. You can see an ear over here, and the eyes over here, trying to find out the relationship between the eyes here. Should be 1/3 in the middle and 1/3 in the other eye. And also to have a look here, moving down to the thorax, trying to see the 4-chamber view. Let's see, we have a cardiac.
Oh, yes, you want color or?
No, just in black and white. If we have, let's do magnifying here the heart. Here, yep.
Oh,
Okay, we have 5 planes for the heart. You know that the first one is just to see where is the stomach. If you get the stomach over there and you move a little bit up, you will see that the apex of the heart should be in the same place. And here you can see that this baby is showing the 4-chamber view quite clearly. You see the ventricular septum, and you have the left and the right ventricles over there, the 4-chamber view. And also if you move a little bit up to the supramediastinal area, you will see the 3 vessels over here. One is the pulmonary artery and the aorta over there. This is a quite important view that you should get every time that you are checking the heart, every time that you scan a baby in the 2nd or 3rd trimester. You can see here what I call the PAC, pulmonary, aorta, and cava over here, and this is the area of the trachea over here. Doesn't mean that you have a normal 4-chamber view plus normal 3-vessel view. If you move down, you will see part of the renal shadows, just to see if there is some dilatation. Normally, the echogenicity of the kidneys is very similar to the one that you get in the intestines. It's quite similar. But anyway, when you have some sort of dilatation, when you see the renal pelvises, you may see it quite clearly. And in this same plane, you can see the insertion of the umbilical cord. Here you can see the vein and the 2 arteries coming into the fetal abdomen over here in the anterior part of the abdomen. And if you move down, you will see here the bladder. If you realize here that the bladder has been increasing in size, this is the twin that actually we had the smaller twin, the smaller bladder in this twin, but you can see this bladder is filling up quite consistently. That means that this is good because it's saying that actually, you know, the circulatory content of this baby is absolutely normal. It's another way to find out that this baby is not under any disturbance in the circulation. If you go to the other twin, it's going to be exactly the same. The 2 babies are looking at the same side, over here. Let's try to get the 4-chamber view again. You need to use some magnification and also to narrow a little bit, you know, the zoom, just to concentrate your ultrasound in that area. And you can see here, this is not as clear as the previous one. Sometimes you get some difficulties in scanning, especially the heart. That's why I mentioned to you this needs to be done by high-resolution ultrasound equipment, and also need to be done with all of these. Good. Well, let's go to see if we can do some Doppler studies here. Normally, if you go to the Doppler, the umbilical cord, that's a very important piece of information. You should use color Doppler over here. We can decrease a little bit the velocity over there just to see the umbilical cord. Look at the umbilical cord, normally is coiled. There is a helical fashion over there. If you go to the power, to the Doppler, you can see here that you get a very nice waveforms from the umbilical artery. You can see that should be end diastolic flow in these babies. If you have one, then you go to the other one, and you do exactly the same. Just go to the baby's tummy to find out where is the umbilical cord. Is the only way to find out, especially in the third trimester, because you may have some problems trying to find out which umbilical cord is which. But here, if you go to the area of the insertion of the umbilical cord, you will always be able to find out the cord in these fetuses. You can see here, close to the, okay, go. Sometimes the babies are moving. This is not the best way to do Doppler analysis over there. Okay, here we are. But you can see also there is end diastolic flow velocities in these babies. Okay, good. Let's try to do some maternal Dopplers as well, because one of the problems in twin pregnancies is not only prematurity, but also IUGR. Just to do Dopplers, we're going to start with the right side uterine artery. When you are on the right side, you can see here the vessels. You just go to the and then you need to change here your setting. This is the uterine artery, the right side uterine artery. You can see it's very sharp. There is no notch in the artery. This is a white normal circulation in the maternal circulation over here. We are going back to the other side. We move to the left. We activate the color flow imaging. You can see here this area, and then we change the scale, and you can see that the uterine artery waveforms in both sides are absolutely normal. Good. I don't know if there is any question from the audience, just to check something else.
Has anyone got anything specific that they'd like to ask Professor Sepulveda? Walter, we've just got a question about the vascular Doppler settings for the uterine artery waveform and what preferential settings you like to use.
She's just asking about changing the scale when you go from the fetus to the umbilical.
Yeah, well, actually, it's something that you start doing without, you just need to fit the waveform according to the size, because actually, the maternal velocities are quite high in comparison with the fetus. That means that you should use your setting and just to try to fit at least 6 waveforms on the screen, and also you just manage the velocities, trying to put the waveform and the baseline in such a way that you're going to see what you want to see. For example, here, if you go to the umbilical cord, you can see here, this is quite, normally you see the umbilical cord here. You can see that they are too small, and then you need to arrange your velocity, and then you invert the waveform. You can see that they fit very clearly. This is the umbilical vein. Yeah, because if you change the scale, you can see that actually could be outside, and you have some sort of aliasing over there. And you can see here the scale, and the scale here is almost 38 centimeters per second. If you go to the maternal, let me put some gel here. Sorry. If you go to the maternal, you will see that actually, the velocity is higher, much higher than the baby. And you go here, it's very easy to see the, okay, it's there, and then we go with the caliper. And then you do, you invert the waveform and increase the scale. And can you see that actually, in the baby was 38 centimeters per second, and here you can see that actually, we arranged this to be in a larger scale because the velocity is quite high, it's almost 80 centimeters per second. But actually, you do automatically with your bottoms over here. It's not a difficult issue to arrange.
Okay, that's fantastic. Thank you, Waldo, very much for that very elegant demonstration, and also thank you to our model for lending us her twins for the last 45 minutes. We just join our hands together and thank Waldo and the model.
Thank you very much.
Okay. Now, we're just going to have a